Others, let's look at this condition, gestational diabetes and preeclampsia. Who is at risk of developing these conditions? Gestational diabetes is the type of diabetes that occurs during pregnancy. It can lead to complications for both the mother and the baby if not properly managed. Now, the causes of this gestational diabetes. The causes of gestational diabetes occurs when your body cannot make enough insulin during pregnancy, and this is due to hormonal changes that affect insulin resistance. The symptoms of this gestational diabetes, to some women, the gestational diabetes may not cause noticeable symptoms, but to some, they experience increased thirst, frequent urination and blood vision, and tiredness. Risk factors for this gestational diabetes include being overweight. This is why eating healthier is very important. Having a family history of diabetes, being older than 25 and from a certain background like African background or Asian background, we are at risk of this diabetes. Managing gestational diabetes include monitoring of blood sugar levels, following a healthy eating plan, and engaging in regular activities. And also taking your insulin or medication being prescribed by your healthcare provider. It is important you attend your antenatal checkups and follow the guidance of your healthcare team to ensure the best outcome for both you and your baby. So when we say regular activities, you are pregnant, yes, so you don't have to develop a sedentary lifestyle because you are pregnant. 20 minutes having a walk is okay. Do your house chores by yourself. The little you can do is okay. Don't lie on the bed all day because you're pregnant. You will be putting yourself at risk of this condition. Now let's look at preeclampsia during pregnancy. This is a serious condition that can occur during pregnancy, and this is characterized by high blood pressure and signs of damage to another organ or system like kidney and liver. So this condition usually occur after 20 weeks of pregnancy, and it can be life-threatening if not properly managed. So please always attend your antenatal care, especially if your doctor have mentioned any of this condition. Always attend your antenatal classes for proper guidance and proper management and treatment. What are the causes of preeclampsia? The cause of this preeclampsia is not fully understood, but is believed to be related to problem with placenta, factors such as genetic factors, immune system issues, and blood vessels problem. This may play a major role. Then symptoms of preeclampsia include high blood pressure, protein in the urine, swelling, that is edema, swelling on the leg or face, severe headache, vision changes, abdominal pain, and shortness of breath. Risk factors for preeclampsia include if you had preeclampsia in your previous pregnancy, there is chances of developing it again. Being pregnant for the first time, obesity over the age of 35, and having a multiple gestation, that is having a multiple pregnancy, can put one at risk. Also, having some certain medical conditions like chronic hypertension before pregnancy, having diabetes or kidney diseases. The management of this preeclampsia also involves monitoring by your healthcare provider. This is by regular blood pressure check and urine test. Treatment include bed rest, medications to lower blood pressure, and early delivery of your baby if necessary to prevent complications. So please always listen to your healthcare provider. Follow your healthcare provider's recommendations and attend all your appointments to ensure the best possible outcome for you and your baby. So thank you for watching this video. Share to your friends, invite your friends to follow my page, and thank you for staying here with me. Bye.
Do you know that during pregnancy, not all women will experience morning sickness? Yes, some people don't experience morning sickness, and it doesn't mean that something is wrong with their pregnancy or something is wrong with their baby. In fact, this set of women, I tag them lucky, and I'm one of them. We don't experience morning sickness from first week to at 7th week or 40 weeks. No morning sickness at all. And you know, this morning sickness is caused by hormone HCG and estrogen. So fluctuation in this hormone tends to make some women experience this morning sickness. You know, our body is wired differently. So some people during this hormonal shift, they don't feel nausea, they don't feel vomiting, you know, they are just fine. So, and this morning sickness again is believed to be due to blood sugar fluctuation, maybe due to a low blood sugar level, you know, and those with a high blood pressure changes, like high blood pressure issue. This tends to provocate this morning sickness. And this morning sickness, just like the name morning sickness, does not mean that it occurs only in the morning. It can occur at any time of the day. But most people during pregnancy experience this morning sickness because it is one of the signs of pregnancy. But if you don't experience it, you're still fine. There's nothing wrong with you. Yes. So if you're experiencing morning sickness or somebody you know is experiencing morning sickness, in this video, I'm just going to be giving us tips to help alleviate this morning sickness. Okay. So if someone you know is experiencing morning sickness, there are several strategies that may help them, such as eating small, frequent meals, avoiding spicy or fatty food, please, and staying hydrated. Okay, but if you are having severe form of morning sickness, which we call hyperemesis gravidarum, then you'll be needing a medical attention, please. So there are some food that can also help you to soothe this morning sickness and also help to soothe the stomach and reduce the nausea. Food like ginger, you know, it is believed to have anti-nausea properties. So ginger can help if you consume a tea made with ginger or ginger tea. So ginger tea can help you because it is known to have anti-nausea property. So this can also help you, but take in moderation. Don't take it too much. Then cracker biscuits or salty cracker. This can also help you. Eating a few cracker before getting out of bed can help you. Can help to settle your stomach. All right. So and lemon can help some women, but it's not about consuming lemon. It's about you can try like lemon water, lemon drops, or even just sniffing a lemon. To some people it helps them, it gives them this relief. You understand? Some people, the scent and taste of lemon in their mouth can give them this refreshing and help them to reduce nausea. So don't just consume raw lemon, but lemon water, or maybe sniffing the scent of lemon. This helps some women. All right. Cervical check or VG examination during labor is very important because it is used to check or to assess the progress of your labor. But it shouldn't be, in absence of some conditions during labor, cervical check shouldn't be done every 2 hours just to check the progress of labor. No, because to some women it makes them to feel uncomfortable, it makes them to feel much pain, and then it triggers fear and anxiety. And you know, during labor we don't want women to be in anxiety or fear because this will delay the progress of labor. If everything is okay during labor, please avoid 2 hourly cervical check. Talking to my fellow midwives now. Yeah. And to you, mother, during labor, you have every right to refuse cervical check. If your midwife have told that everything is okay, your labor is progressing well, there is no condition that they are afraid of or anything, you can refuse cervical check. But you can allow them to do the first one to check the progress of your labor and make sure everything is okay. But if they come for 2 hourly cervical check, it's your right to refuse. But you can allow them as labor progresses. Before you refuse your midwife checking on you because you had from your line midwife, please make sure you have discussed with your healthcare provider. They have told you the importance of cervical check on you, everything you need to know about cervical check. Please, this is very important to get all the information. Cervical check is used to assess labor progress. You understand? So when you are in the hospital, you are the pregnant woman, you are the one to diagnose yourself being in labor. But when you come to your midwife will have to check to confirm that you're really in labor. And your midwife confirmed this by doing this cervical check to know how many cm you have dilated, then assessment of your service. So when you are experiencing regular contractions and your healthcare provider needs to assess how close you are to delivery, this is when cervical check is very important. Then the next one is symptoms of labor, to evaluate if labor has really started or if labor is progressing. If you are having a symptom such as pain, bleeding, or clear or pink sticky discharge, that is the mucus plug, your midwife will do the cervical check to see if you are really in labor. All right. Then the next one is induction of labor. Cervical check is done to decide the best method for induction based on the readiness of your service. You understand? Once they do the cervical check, it will guide them to know the method they will use for your induction. So cervical check can help determine the appropriate medication or procedure for you. Then the fourth one is preterm labor concern. Maybe your midwife is having concern you are in preterm labor, like to check for early signs of labor. If you are having a signs of preterm labor, such as you're having a contraction or your water have broke, or your cervical check can help to assess the situation. This cervical check is done to determine if there is any cord prolapse, and then it will help your midwife or medical team to decide for emergency C-section. So this is to tell you that cervical check can provide valuable information to your midwife, and it helps in your care and management during labor. But they shouldn't be done without your consent. And you have to be ready, you have to relax for it, because we don't want you to be tense while the cervical check is being done. So you have every right to refuse, as I said, but make sure everything is in order before you refuse cervical check. Okay? Let's look at the risk of cervical check. But one risk is that there will be discomfort and pain. Like I said earlier, cervical check can be uncomfortable or painful for some women. When that happens, it can increase stress and anxiety during labor, which we don't want, because we want your labor to keep progressing. Another thing, that there might be a risk of infection. If there is a repeated cervical check, this can increase the risk of introducing bacteria into your VG. This might then lead to infection, especially if you are a patronizing local midwife. You understand? So this might put you at risk of infection. Infection can complicate labor and put you at risk. Both you and the baby can be at risk, and premature rupture of membrane can also happen if there is repeated cervical check, though little chances of premature rupture of membrane, but it can still be possible. So reduce repeated cervical check during labor. Another risk is that if cervical check is being done by inexperienced traditional midwife or inexperienced midwife, there could be a sense of forced labor progress. This is a concern because it can cause unnecessary anxiety or lead to premature intervention. Thank you for watching this video. If you find this video helpful, why not share to others and keep inviting your friends to follow us.
5 things you must do during labor. But most important is that you need to listen to your midwife or your doctor's advice during labor. Obey them, whatever they ask you to do, please do it. It's for your own good. Now let's look at 5 things you need to do during labor. Number one is to eat often, but in a little quantity. Don't overload your stomach with food, because during labor, you need the energy to sustain you, because labor is like a physical activity, the physical work. So your body needs all the energy it can get to sustain you during labor. During labor, your womb and the cervical muscle, they will be engaged in intense activity, contracting and trying to push out the baby. So you need all the energy. You need all the energy you can get to keep you going. So please, I would advise you eat snacks in little quantity. It will help to give you the energy you need. Don't go and load your stomach with fufu and said one midwife said you should eat. I say eat little and often, because you need that energy. Number two is to stay hydrated.
Our body is made up of 70% of water, and our muscle need to be hydrated to work very well for us, especially during labor. So, sip regularly on water or any recommended fluid from your midwife, please. Number three is changing of your position. Please don't make mistake of staying one place during labor because if you feel like when you change position, the pain will be intense. Please don't stay at a place during labor. Keep changing your position during labor, except you have been asked to stay at a place. Otherwise, keep changing your position. It will help you to increase the progress of your labor because when you are staying one place, it will make your labor progress to be slow. So it is important to change position. Number four is emptying of your bladder. Empty your bladder frequently. Most women during labor, they tend to ignore this part. The women will tell you they can't void anything. They go to the toilet, they just void very little. We need you to void that very little. You need to keep emptying your bladder because full bladder during labor will occupy space in your pelvis. And this space, your baby needs all the space it can get to pass through your pelvis. So we advise you empty your bladder regularly, which will help you to have a smoother and more comfortable childbirth. Number five is breathe deeply and slowly. Don't gasp for air or try holding your breath during contraction, but you need to breathe slowly. It can help um, during contraction when you are breathing slowly and deeply. It will help to oxygenate your body and allow blood flow to your womb, which in turn will help to decrease the pain. But when you are holding your breath during contraction, you are causing more pain to yourself. But when you are breathing slowly and deeply, you will find out that it will help to decrease the pain. Thank you. And please make sure you're following our page and you're inviting your friends to follow us. This is online midwife, Mary Ifoma. Signs could indicate that a baby is in a head down position and ready for delivery. Hello, mothers. So in this video, I'm going to be telling us signs to show that your baby is in a head down position and ready for delivery. So if you're an expectant mom, especially if you're a first time expectant mom, please watch this video and remember to share to others. Feeling your baby drop is a sign that your body is getting ready for labor, and this is natural process, which means your baby is settling down deeper into your pelvis and ready for delivery. And this is also called lightening. So at this stage, you will experience less heartburn. Like if you are experiencing heartburn, but once your baby descend down into the pelvis, you will experience lesser heartburn and having easier breathing. You understand? But there will be frequent urination because the baby have descended down into the pelvis, and then there will be changes in how you walk. You'll be having back pain, pelvic pressure, and some women may even experience hemorrhoid because the baby's head is already down into the pelvis and pressing on some other organs down the pelvis. During the third trimester, by 32 weeks, most babies are in head down position. So I know some women want to ask, when should my baby turn into head down? So by 32 weeks, most babies are already into head down position. Not all, please. But if your baby position is not head down, no need for you to worry. You don't need to worry. As some babies tends to turn during labor. Some even turn before or even during labor. So if yours have not turned, no need to worry. You still have time for your baby to turn, even while you are in labor. So baby makes the turning, okay? So before labor, there are some other signs that will indicate that your baby is already in head down position. Like I mentioned earlier, but these are other signs. Well, one is feeling of the head. You might feel a hard round shape. That is the baby's head, low down in your belly. You will feel the round hard part down your belly. Then you will feel the bottom or the leg above your belly button. Some women, they can feel this when they palpate their abdomen, all right? If you cannot feel it, your midwife can also feel it and let you know. The number two is movement. Larger movements like kicks are often felt higher up towards your rib cage, while smaller movements like hands and elbows are felt in your pelvis. Because remember, the head is already down, so the head and the hand is down there. So you feel the little small movement there, then the hard movement up because the baby's buttock they are up with the leg. Okay. So number 3 is pelvic pressure. You may experience a heavy feeling or pressure in your pelvis as the baby's head engages. That is when you will see some women complaining of pressure near their pelvic area, and it makes their walking difficult. This is because the baby have already engaged, and it's very okay. Number 4 is shape of the belly. Your belly might appear lower and more protruding at the bottom, which is also the lightening I talked about earlier. So, but if you're unsure about your baby's position, your healthcare provider can confirm it through physical examination, or you can go for ultrasound scan to confirm the position of your baby. But if you can note these signs, it will also help you to know if your baby is already held down position. As you are approaching your due date, some doctors might try to perform external cephalic version, that's ECV. This is to help you, to give you the chance to go through VG delivery if that is what you want and it's so important for you. But not all doctor advise on this ECV. So just give yourself time. Some babies can turn during labor. All you need to do is make sure you are a little bit active. It will help the baby to make the movement and turn. So keep being active, keep taking a walk, and and your baby will be in a head down position. But if your baby is still not in a head down position during delivery, during labor, and due to the position of your baby, your doctor advised you go for C-section delivery, please listen to your doctor, because not all breech position that can be delivered VG. You understand? So if your position of your baby is in upward position and labor have set in, and you're already in labor and babies have not turned yet, and the doctor advised for C-section delivery, please. The important thing here is life of the mother and life of the baby, irrespective of the method of delivery. Okay, so thank you for watching this video. Remember to share to others and invite your friends to follow this page. See you next time in my next video. Stay positive. Do you know that malaria can have serious consequences for both the mother and the baby if not properly managed? Because I've seen some questions like, what is the best anti-malaria drug to take during pregnancy? No, you don't have to do that. No self-medication during pregnancy. Now let's discuss the importance of preventing and treating malaria during pregnancy. Pregnancy is a beautiful journey, yes, but it comes with its own set of challenges. One of the most serious risks pregnant women faces is malaria. Malaria in pregnancy can have devastating effect on both the mother and the baby. It can lead to severe anemia, low birth weight, premature birth, and even death. The good news is that malaria in pregnancy is preventable and treatable. Pregnant women living in malaria endemic areas should take preventive measures by sleeping under insecticide-treated bed nets and taking anti-malaria medication as recommended by healthcare provider. If a pregnant woman gets infected with malaria, it is important to seek prompt and effective treatment. Malaria in pregnancy should be treated with safe and effective anti-malaria drugs under the supervision of healthcare provider. Remember, prevention is the key when it comes to malaria in pregnancy. By taking the necessary precautions and seeking timely treatment, you can protect the health of both you, the mother, and the baby. So always be proactive during pregnancy. Your healthcare provider will provide you with the safe anti-malaria drugs during pregnancy. Don't just take any anti-malaria drugs. Thank you for watching my video, and if you have value in this video, invite others to follow, like my video, comment, and share to others. Bye. During pregnancy, eating well is one thing you need to do for yourself, or one good thing you need to do for yourself. Because good nutrition will help you to handle the extra demands on your body. As your pregnancy progresses, your body demands more nutrients. So eating well will help you to meet up with these demands. All right. The goal is to balance getting enough nutrients to support the growth of your baby and also to maintain a healthy weight. Did you hear that? Maintain a health. You are getting a nutrient to support your growing fetus, and you're also maintaining a healthy weight. So that means you don't have to eat for two. You have to eat healthier. so that it can maintain a healthy weight, as well as giving your baby the required nutrients. So because some mothers or some women might not meet up with these requirements, these nutrients requirements, that's why taking a prenatal vitamin supplement is very important during pregnancy, because these supplements are formulated to provide essential nutrients to support a healthy pregnancy. But we need to understand that prenatal vitamin can't help you to get pregnant. Understand? Take it 3 months before conception. They just need to provide you with nutrition your baby or your body needs to prepare for pregnancy. Take it 3 months before pregnancy. So if you're pregnant already, it's also important to keep on taking your prenatal vitamin. You know, some women, they don't like taking prenatal vitamins. So in this video, I'll be telling us the importance of prenatal vitamins and why you need to always take your prenatal vitamins. If you're taking a protein drug or pregnant care, they all contain folic acid, iron, calcium, omega-3 supplements, and all of that. So this is why it is important for you to start taking your prenatal vitamin before conception or once you have conceived, especially if you don't trust you are getting enough nutrients from the food you eat. It's important to supplement with these prenatal vitamins. So now, folic acid. Folic acid helps to prevent neural tube defects, which are serious abnormalities of the fetal brain and spinal cord. So it's recommended that you start taking your folic acid 3 months before you conceive, so that it will prepare your body and also prevent this neural tube defect. All right, it's very important. Folic acid, please. So number 2 is iron. You know, iron support the development of placenta and fetus, and it also help prevent anemia by aiding in the production of blood or supply of oxygen to the baby. Number 3 is calcium and vitamin D, which promote the development of baby's bone and teeth. Then the next one in the prenatal vitamin is omega-3 fatty acid. This is important for the baby's brain development. So if you don't consume enough omega-3 through your diet, supplement is very important, please. Okay? Protein drug or prenatal supplements, they all have side effects. So this is why it is important to always make sure you are taking supplements that is being prescribed by your healthcare provider, right? Because in some women, they may experience side effects such as constipation due to the iron content of the prenatal vitamin. So if you're experiencing constipation due to this, all you need to do is to drink more water and eat a high fiber food, and also contact your healthcare provider. They might change your prenatal vitamin for you. Thank you for watching this video. If it is helpful, share to others. See you next time in my next video. Stay healthy always. Bye. Getting heat in the stomach during pregnancy, the impact of falling with your stomach during pregnancy or getting heat on your stomach during pregnancy. If you are still in your first trimester, the good news is that your baby is still in the pelvis. So if you had a minor heat on the stomach during pregnancy in your first trimester, there might be no much impact. But if you're on your second trimester and you got heat or you fell down with your stomach, there might be serious impact. But whether you are in your first trimester or second trimester, at any time during pregnancy you got heat on the stomach, please report to your doctor and give your doctor the details of the heat or the details of the accident. This will help in your management and care. So what are the potential risks of getting heat in the stomach during pregnancy? The risk of having accident or getting heat in the stomach during pregnancy include preterm labor, placenta abruption, or fetal injury. So this is why it is important to report any accident on the stomach during pregnancy, whether they are minor, whether you have minor impacts or not, or whether you are having cramp due to the heat or not. Just report to the doctor for medical evaluation. Irrespective of the symptoms you present with, seeking medical attention is very important because your doctor has to evaluate you and see how much trauma you had from the heat. So please seek medical advice at any time, maybe whether your toddler hit you on the stomach or you fell down or you had an accident and you hit your stomach somewhere or on the hard floor. Please report this to your doctor. So how do you prevent being hit on the stomach? Always be mindful of your surrounding and taking precaution in crowded spaces or when engaging in physical activities. If you have active toddler, please always make sure you are protecting your stomach because most time they innocently run to you and they can even use their head to hit you on the stomach. As minor as you think it is, it might have impact to the baby in the uterus. So please always be mindful of environment and be protective of your stomach during pregnancy. Thank you for listening and watching this video. Keep inviting your friends to follow this page. Bye. Today let's discuss newborn jaundice. Like we know that the jaundice is a common condition that causes yellowing of the skin and the whites of the eyes. So the symptoms of this jaundice, like I just said, is yellowing of the skin, which usually appear within the first few days after birth. So then another symptoms to watch out for is dark yellow urine. Normal urine should be colorless. So when the urine is dark yellow, it's a sign of jaundice. Now, someone might ask, what causes this jaundice? Jaundice is caused when there is bilirubin built up. There's something we call bilirubin. So we're not going to go into detail, but we just have to know that it happens when there's this bilirubin build up. Then jaundice occurs due to the accumulation of this bilirubin in the blood, and this bilirubin is produced when the red blood cells break down. Then a newborn have an immature liver, that is, they have liver that is less effective to process this bilirubin. This is why most immature babies comes up with jaundice more than matured babies. All right, and it also happens when there is high red blood cell count. Babies have a high number of red blood cells that is frequently broken down and replaced. So this also causes jaundice. Then what are the risk factors? Premature babies, that is babies born before 37 weeks of pregnancy, are more likely to develop this jaundice due to their immature liver, like I said earlier. And studies show that breastfeeding babies have a slightly higher risk of having jaundice because breast milk can sometimes interfere with the bilirubin elimination, but benefit of breastfeeding mostly outweighs this risk. Okay, so breastfeed your baby, no problem. Another thing is incompatibility. If the mother and the baby have different blood type, that is, if there is resource incompatibility, can lead to increased bilirubin level in the newborn. Then bruising or hemorrhage. Trauma, when there's trauma due to childbirth, this can cause excess bilirubin production. Another thing is siblings with jaundice, like that is a family history of neonatal jaundice might cause the increased risk. Infection or illness, certain infection or underlying health condition can affect bilirubin metabolism. Okay, so that is why it is important to treat your infection during pregnancy because there's still slight chances of this causing jaundice. So the next thing we need to understand about jaundice is that during pregnancy might not cause jaundice directly, but there are some factors that may indirectly affect your baby's risk. Okay, so factors like I said earlier, blood type, resource incompatibility, it can lead to increased bilirubin level. Then infection, I just mentioned it, infection and illnesses during pregnancy. So we need to take precaution to avoid infection and illnesses. I've seen some mother asking if it's okay for them to treat their infection, or some not wanting to treat infection during pregnancy. This can affect your child, so treat your infection during pregnancy. Then another thing you can do is to maintain a healthy lifestyle during pregnancy by eating a healthy diet, staying hydrated, avoiding alcohol, smoking, and also avoiding self-medication. All these things can help to prevent risk to your baby. Always take your prenatal appointments very important. Always attend your prenatal visit. This will allow your healthcare providers to monitor your health and also take care of any potential issues that might come up earlier on. So treatments of jaundice, most cases of jaundice resolve without treatment within 10 to 14 days. Please avoid the use of herbal treatments or any other type of treatment, because mostly this jaundice resolves on its own. So another treatment is what we call phototherapy. That is what the baby will be exposed to a special light. So this phototherapy may be used if bilirubin levels are very high. So this is why it's important to take your child to the hospital. Don't stay at home and keep on administering home remedy. Let's look at effects of untreated jaundice in newborn. Some complications may arise, like when there's excessive bilirubin. It might damage the brain or central nervous system. And these symptoms, when the brain is damaged, the symptoms will include poor feeding, baby being lethargy, muscle weakness. And if it's left untreated state, it can cause cerebral palsy, hearing loss, and then learning disabilities as the child is growing. Okay, so there will be bleeding, and this bleeding could lead to anemia. Then infection can also be another complication. And in some infants, you will see something like abdominal bloating, swelling of the legs, and then liver failure. So this is why it is important to treat jaundice as urgent. Take your child to pediatrician for them to review your child. All right, so I just hope you get one or two things out of this video, and please make sure you keep inviting your friends to this page and keep following us for more. Thank you. Stay healthy, stay positive. Bye. See you next time in my next video. Hello. So in this video, we'll be looking at food to avoid during pregnancy and why. To avoid all kinds of unpasteurized dairy product like milk and cheese. There's a small chance that unpasteurized dairy product may contain Listeria bacteria, which can cause infection, and possibly it could lead you to having miscarriage or stillbirth. So we don't want to take any chances, right? Yes. So the next thing you need to avoid is meat and poultry products. Yes, but you need to eat your meat as long as it is well cooked with no trace of blood in it. So you need to avoid raw or undercooked meat. You need to avoid liver or all kind of liver product, because there is a small risk of getting toxoplasmosis, which can cause or lead to miscarriage. The liver and yeast product have a lot of vitamin A in them, which can be harmful to your unborn baby. All right, then you need to avoid eating egg. Eat your egg. Eat your egg, but eat your well cooked egg, and avoid raw or partially cooked egg, because there's a risk of salmonella in a raw or undercooked egg, which might put you at risk of food poisoning. Okay, so avoid that. You don't want to suffer food poisoning while pregnant. The next one is fish. Eat your fish, eat your well cooked fish or seafood, but you need to limit your portion to 1 or 2 portions a week, especially if you're eating oily fish like salmon and mackerel. But please, you need to avoid salt fish or raw shellfish, because they could be contaminated with bacteria that can cause infection, then leading to you having miscarriage or stillbirth. So avoid that, please. Then you need to avoid or limit eating tuna fish, because it has more mercury in them than other fishes. So if you eat too much mercury, it can be harmful to your unborn child. Then be careful the way you take vitamins, especially vitamin supplement. Women will like taking supplement a lot. So when you are pregnant, or if you are pregnant, please know how you take vitamin supplements. Please do not take high dose multivitamin supplements with vitamin A in them. You know what it does already. So, and remember to contact your healthcare provider if you are feeling unwell, or maybe you think you consume something that makes you to feel unwell and you are suspecting food poisoning. So Don't treat yourself or don't take it lightly. Make sure you contact your midwife or your doctor. Thank you for watching this video. Keep following us and keep sharing our video to others. See you next time in my next video. Bye. Hello mothers. I've dropped like 2 videos on postnatal depression. And postnatal depression is one topic we shouldn't run away from because it is happening. So I received this message in my DM, and then I felt the need to say something more on postnatal depression. You may need to go back and watch the video I made on postnatal depression, because in this video I'm just going to give us story, because I'm just going to give us stories on postnatal depression, how to recover from postnatal depression, and all of that. And hopefully the story will help us in this struggle of postnatal depression, because motherhood is it's a struggle, but most of us don't know, because after delivery, most women goes into postnatal depression, and some women also goes into fear. I don't know if it's just me, or do we have people that goes into fear of losing their life and then leaving their kids to the mercy of another woman. These are the struggles of motherhood, and so many other struggles we don't even mention. But we need to keep emphasizing on this postnatal depression, because it is real. We can't run away from it. Even though we're Africans, we are strong, yes, but even in our strength there is still atom of weakness. So please make sure you take care of yourself after delivery. Speak up when you need to. So postnatal depression, also known as postpartum depression, is a mood disorder that affects some mothers after giving birth. Some, because it's not every woman will experience postnatal depression. So it is essential to recognize the symptoms and seek help. Please seek help, don't keep quiet. So here is my story on Joy, who developed postnatal depression after delivery, and her healing process. Enjoy the story. Joy's healing journey, overcoming postnatal depression. Joy had always dreamed of becoming a mother when her baby girl Lily arrived. When her baby girl Lily arrived, she expected to feel nothing but joy, just like her name. However, reality hit hard. Instead of feeling happy, Joy found herself overwhelmed, anxious, and constantly in tears. Joy struggled with sleep deprivation, hormonal changes, and the immense responsibility of caring for a newborn. She felt isolated, even though she was surrounded by family and friends. Guilt set in at her, and she was like, why wasn't she enjoying motherhood like everyone else seems to? Seeking help. One day, Joy confided in her best friend, Sarah. Sarah listened without judgment and encouraged her to seek professional help. Joy visited her doctor, who diagnosed her with postnatal depression. The doctor explained that it was common and treatable. Joy's treatment plan included talking therapy, self-help strategies, and when necessary, antidepressant medication. Self-help strategies. Joy learned to prioritize self-care. She talked openly with her partner about her feelings. She accepted help from loved ones, allowing them to assist with household chores and baby care. Joy made time for herself, reading, taking walks, and practicing relaxation techniques. She focused on getting enough rest, even if it meant napping during her daughter's daytime naps. Talking therapy. Joy attended cognitive behavioral therapy sessions. With her therapist's guidance, she challenged negative thought patterns and learned coping strategies. Connecting with other moms in a support group helped Joy realize she wasn't alone. They shared stories, tears, and laughter. Recovering. Over time, Joy's symptoms improved. She began to bond with her daughter and experience moments of joy. The healing process. The healing process wasn't easy. Some days were harder than others, but Joy persisted. With ongoing support from her therapist, Joy regained her sense of self and found hope, a new beginning. As her daughter grew, so did Joy's confidence. She learned to trust her instinct as a mother. Joy's journey taught her resilience, compassion, and the importance of seeking help when needed. She became an advocate, spreading awareness about postnatal depression and encouraging other moms to reach out. This is the end of the story. So remember, seeking help is a sign of strength and not weakness, as I always say. So if you see someone you know experiencing postnatal depression, know that the healing is possible. So reach out to your healthcare professional. You are not alone on the journey. Thank you, and I hope that this video will inspire someone today and provide insight into the healing process. If you have any other requests or you need any other further information, please reach out to us in our DM, and I'm going to drop a link to our WhatsApp group. It's a community that comprises of midwives and other experienced moms. We are just there to share each other up. If you're interested, I'll drop the link in the comment section. You can click through the link and join us. It will help you a lot. Thank you for staying with us in this page. I'll keep inviting your friends to follow this page. Bye. See you next time in my next video. Stay healthy and everything stay positive.
Hi mothers, let's look at one of the most commonest pain women complain of during pregnancy called round ligament pain. Round ligament pain is a sharp pain or a jabbing feeling often felt in the lower belly or groin area. It could be on one or both sides of the groin. It is one of the most commonest pain most pregnant women complain at second trimester. This round ligament pain during pregnancy, there are some ligament that surround and support the growing uterus. And one of the ligaments that support the growing uterus is this round ligament. Now, this round ligament, as the round the round ligament connect the front part of the womb to the groin. That is the area your leg attached to the pelvis. Now this round ligament normally tightens and relax normally, and it relaxes when it tight it relaxes slowly. But during pregnancy, as the baby is growing, the round ligament stretches, and that makes it more likely to become strained, and then the sudden movement we make during pregnancy, and this brings about the pain you normally felt. It's uncomfortable, but still it is normal. And because of the nature of it being uncomfortable, that's why most women complain about this pain. But it is very normal. It can only be consigned when the pain is too severe, you're having difficulty in walking, and during urination you're having a painful sensation while you urinate. Please, this is when you will call your doctors. Thank you, and keep following this page. Bye.
Do you know that during pregnancy, some women may experience nose bleeding? So nose bleeding during pregnancy are common, like it's common, and this is due to hormonal changes and increased blood flow that can cause the blood vessels in the nose to become fragile. So this is not, there's no cause for alarm here, but to some women it is a frightening sight. So today let's look at what you can do if you are having nose bleeding during pregnancy. Of course, the first thing you need to do, your instinct will usually push you into immediate action during nose bleeding. So the first thing is to sit upright and lean slightly forward to prevent this blood from flowing down your throat. Okay, so the next thing is to apply a cold compress to the back of your neck, or you apply it on your nose to constrict the blood vessels and reduce this bleeding. So but how do you prevent this nose bleeding during pregnancy? So the preventive measure is just for you to stay hydrated by drinking plenty of water. Use a humidifier at your home, or use a humidifier to keep nasal passages moist. Then you need to avoid strenuous exercises, okay? Just a little moderate exercise is what you need during pregnancy. Be gentle when you're blowing your nose and avoid picking your nose. Remember I said The increased blood supply to your nose will make the blood vessels very fragile. So when you peak vigorously, there is possibility of you having nose bleeding, or when you blow your nose too harsh, you will have nose bleeding. But if you keep bleeding or the bleeding keep reoccurring, please make sure you mention that to your midwife or your doctor. Thank you for watching this video. Keep inviting your friends to this page. Share our video to others. See you next time in my next video. Bye. Baby's first bath, when should it happen? When it comes to baby's first bath, it should be when you are ready. There is no rules regarding when you should or when you shouldn't bathe your baby, but you need to keep some things in mind regarding baby's bath. Babies struggle to regulate their body temperature few days after delivery. So if you're going to bathe your baby first couple of days, you need to make sure that the bath time is short and that the room and towels are warm. World Health Organization recommend waiting for at least 24 or 48 hours after delivery before bathing your baby. I know some of you won't like to wait, so that is why it is important to bathe your baby when you feel you are ready. Then it's also important not to bathe your baby for the first time when you are stressed, because this will make you to be more stressed. So bathe your baby when you are comfortable, because you need to enjoy the process, because it is a bonding process as well. So make sure you are ready for it. You're ready for the first bath and have everything you need at hand, except you have someone to help you bathe your baby. Otherwise, wait till you are ready. So another thing you need to consider is that there is something called venice. This is what covers the baby's skin. It is a waxy white substance that covers the baby, and this helps to protect babies against bacteria, and this will naturally absorb into baby's skin. So avoid removing it by delaying baby's first bath, okay, because this is also known as nature's moisturizers for baby. And then some research also says you should wait until the cord falls off. So all you need to do is just clean the baby's body with clean water and sponge until the cord falls off before you can give your baby proper bathing. I know Africans who can't wait until the cord falls off. So if you must bathe your baby, please don't use scented soap or harsh soap. Just simple bathing. Your baby's skin is not dirty, so avoid too much scrubbing and all that. Just give your baby quick and simple bath. So now let's see step-by-step guide that will help us to give our baby first bath. Now in preparation, you need to gather everything you will need: a baby bath or a clean washing up bowl. You can also use a sink. Then you get 2 towels, cotton wool, a clean nappy or a clean cloth. Another thing is ensure that the room is warm, as babies can get cold quickly. Then next one is water temperature. Fill the bath with cold water first, then add hot water to achieve a comfortable temperature. Then you need to test that water by dipping your elbow in it. It should feel similar to your body temperature. Then bathing process itself. Hold your baby on your knee and clean their face first. Then wash their hair with plain water, supporting them over the bowl. This time you've not removed the cloth, you've not removed their nappy. After cleaning the face and washing the hair, then you remove the nappy and wipe away any mess. Then gently remove the cloth and then lower your baby into the bath or bowl, squishing water over them without splashing. Please don't splash water, just gently pour water on their body. Then always keep their head clear of the water at all times. Never leave your baby alone in the bath, please. Then the next thing is drying and massage. Lift your baby out and pat them dry, paying attention to skin folds or line. Then after bath, consider massaging your baby to help them relax and sleep. Then remember, you don't need to bathe your baby or your newborn baby every day. 2 or 3 times a week is enough. But I know we can't do without bathing our baby every day. So once a day, if you're going to bathe your baby every day, once a day is okay. Stop disturbing this baby. You wake the baby early in the morning to give the baby early morning bath. Then in the evening, you bathe the baby again. Did she go to farm? Oh, please don't disturb the baby. No, newborn baby, first few days after birth, they are always sleeping. So leave your baby. You can only wake your baby during feed time. Otherwise, allow the baby. Don't bath your baby every day. But if you're going to bath every day, once a day is okay. Otherwise, 2 to 3 times a week is perfect. After delivery and you're going to give your baby first bath, you need to enjoy the special time with your little one, because baby's bath time is also a bonding time. Thank you for watching this video. I hope you take 1 or 2 things out of this video. Remember to invite your friends to follow this page, and remember to like and drop a comment for us. See you next time in my next video. Bye. When it comes to practicing safe knacking position during pregnancy, there are key factors you need to consider. But one important aspect of it is ensuring the comfort and safety of both the partner and also their unborn baby. And also try avoiding putting pressure on the abdomen. Another factor to consider is finding a position that allows for deeper penetration without causing any kind of discomfort or pain. So during pregnancy, knacking is very safe. Don't deny your partner because you're pregnant. And I've seen a situation where a woman lost her baby because her girl was too rough. So that is why it's important that during pregnancy, make sure that you are in charge. You, the woman, you'll be in charge, and make sure there's no form of discomfort. And then if a guy is too rough and you have what is called placenta previa, there are chances of you bleeding, and that could cause the death of the unborn baby. So during the first trimester, it is considered safe for you to continue your most intimacy activity, unless your doctor have advised you not to. Maybe you have placenta previa. So, but if there is no medical advice against that, please continue with your normal intimacy activity. But you women experience sensitivity or tenderness in their breast or abdomen during first trimester, it's important to communicate to your partner about your discomfort and communicate your feelings to him. Both of you should work it out so that you don't feel any form of discomfort or pain during the activity. During the first trimester, you may consider lying on your side, facing away from your partner, while they spoon you from behind. This is called spooning position. Another position you may try is side lying position. That is when the both partners lie on their side, facing each other. This is another position good during first trimester. Then woman on top is another position you should also try during first trimester. This will allow you to control the depth and pace of penetration, while also helping you to avoid pressure on the abdomen or belly. So during the second trimester, this time the baby is growing bigger, the abdomen is getting bigger, and there are changes that occur in the body during second trimester. So as the body is making all these adjustments, choose a position that both of you can enjoy. So you can try modified missionary position. During the first trimester, it's okay to do your missionary position, but during the second trimester, you modify this position. Modify the position by elevating your hips using pillow. That is putting pillow under your buttock. This will help to reduce strain on abdominal muscle. So number 2 is rear entry or entry from the behind, otherwise called the OGGY position. Okay, so you can try kneeling upright. This will help for deeper penetration without putting weight directly onto your stomach. Then another position is cross leg sitting position. You sit face to face with your leg crossed over one another, allowing intimacy. but reducing direct pressure. So during the third trimester now, in late pregnancy, finding comfortable position becomes even more important due to an expanding belly now, and also there is potential fatigue or discomfort you may experience during the third trimester. So it is important to prioritize comfort and safety for both partner, for you and your partner, and also remember the baby, no pressure to the unborn baby. So during this third trimester, the only recommended position here should be side lying position. Both of you lie on your side facing each other. Then this will allow for close contact while minimizing pressure on the abdomen. So I hope this helps someone today. Go ahead to continue having intimacy activity with your partner. Don't be afraid. Your baby inside is well protected. So, and always try to find a comfortable position. Try some of this position I've mentioned, and also you can, move things around and find a comfortable position for yourself. But in everything, make sure you are communicating with your partner. Communicate when you are when you are feeling discomfort, when you are not comfortable, because you are supposed to make sure you are enjoying every bit of it during pregnancy. Thank you for watching this video. Please help me to share to others. Invite your friends to follow this page. Bye. See you next time in my next video. So first time pregnant mothers, come over. Preparing for a newborn essentials can feel very overwhelming. And at the end of the day, some first-time pregnant mother end up buying what they don't even need. So in this video, I'm going to be telling us baby essentials. But before we go into that, let's look at the items that government need to ban first. There are some babies items that you don't even need. So government need to ban those items.
Make on me panza, 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 make on me.
So thank you, government, for banning those items. Now let's look at the essential ones. For your baby's health, you need baby's thermometer. This is very important. This will help you to monitor your baby's temperature. You also need paracetamol at home. Very important. Please, you'll be needing nail cutters or nail clippers or trimmers, depending on how you call it. This will help you to keep those tiny nails in check. Please don't use your teeth to bite your baby's nail. Then you can also get a baby's toothbrush. Get that one and keep it away until your baby's first tooth appear. So, and you know that baby's first tooth usually appear from 7 months, depending on the baby. So it can appear earlier or later, but just get it and keep it till when the first tooth appears. You'll be needing baby vest. This is essential for layering. Depending on the weather, you wear that first before you put on other clothing. Then also go for wool or cotton materials. Buy baby stockings. You need to cover and protect that tiny toes. So buy baby stockings. You can as well get all-in-one stretch suit. This is perfect for day and also night wear. Then a shower is also okay. This is great for warmth and comfort depending on where you are and the weather. If you feel to cover your baby with shower, it's okay, you get that one. But if you're in a hot weather, please make sure you don't overcover your baby. Baby's cloth storage is also very essential. This will help you to organize your baby's wardrobe. So you get that one, is perfect. Then diapers. This is a must-have, of course. You must have your baby's diaper and wipes. Then baby's coat. I would have said let government ban this one, because most time women will got this and we end up not using it. So, but it's essential in the sense that newborn has to be sleeping alone. Don't go sleep with your baby. Another one is bob cloth or bibs. This is essential for clean up, spit up messes during feeding time. So you get a bib, plenty of them. Then you get a baby's towel or washcloth, soft material designed specifically for sensitive baby skin after bath time. So you get the ones that is designed or made for babies, please. So Did I forget anything? You add it in the comment section. I hope this is helpful. Thank you and see you next time. Bye. Have you heard about pregnancy dreams and nightmares or vivid dreams during pregnancy? During pregnancy, it's common for you to dream. It's common for your dreams to change or for you to have a vivid dream. That is producing a very powerful, strong, clear dream. And today I want to tell you that this is totally normal. During pregnancy, some women turn to Joseph the dreamer and some turn to Joseph the interpreter. And then once we had this dream, sometimes if the dream is more in the negative way, we try to pin it on someone or try to find someone to blame. Possibly we try to blame our village people. Maybe they're after us in this pregnancy. But it's not like that. You had that dream because of the fear. Maybe you are nursing fear in your mind during the day. Maybe you're having a negative thought of not delivering successfully. You understand? So if you are having that thought, there's possibility of you having a dream where you delivered your baby and you didn't make it, or where your baby didn't make it alive, because you already have that thought, you already had that fear during the day. And during pregnancy also, so women will have an increased dream recall. When you're not pregnant, so women, when they dream in the daytime or when they wake up, they can't recall the dream. But during pregnancy, you will start having a clear recall of your dream. These dreams are a natural part of the process and usually not a cause for concern. So, nightmares during pregnancy can be triggered by various factors. So, but one common factor is hormonal changes. That's why I said it's not village people anything. It's still hormones that are doing all these things. Hormonal changes, fluctuation in hormones, especially progesterone, it can affect sleep pattern and dream content. This hormonal shift may lead to more intense or vivid dream. Another factor is anxiety and stress. Pregnancy can bring about anxiety related to childbirth, parenting, and other life changes. You're trying to figure out how you will transit from singlehood to motherhood, all the responsibilities. So all the stress and worries, they can manifest in your dream. Sometimes taking the form of nightmare. You can even see yourself where you failed in your parenthood because you already having anxiety towards that. Then physical discomfort can also bring about dream as your body changes during pregnancy. Discomfort like back pain, frequent getting up to urinate, and heartburn. All this can disrupt sleep and influence your dream content. Then emotional processing. Dream often serve as a way for the mind to process emotions and experiences. So please remember that occasional nightmares are normal, but if they cause discomfort or you are having significant distress, consider discussing this with your healthcare provider. They can offer you guidance and support. But as long as these dreams are not causing any distress or interfering with your sleep, they are nothing to worry about. So have a sweet dreams and don't blame nobody if you are having a dream where you lost your life or you lost your baby. Please, it's just normal. It's just your hormone playing tricks, or your emotions, or you know your stress level you're trying to process everything and they manifest in your dream. So it's nothing, but just be prayerful and take it as a normal occurrence. Bye, see you next time in my next video, and I hope you learned this today. Dream during pregnancy or vivid dreams during pregnancy are due to hormonal fluctuation. Today, let's understand postnatal depression. Postnatal depression is a type of depression that affects women after childbirth. This is a mood disorder that affects women after childbirth. And this postnatal depression occurs 1 year after giving birth. And now let me tell us that if you are suffering from postnatal depression, just know it today that you are not alone, because according to research, 1 out of 10 women suffers postnatal depression. So calculate how many women gives birth every year, and then 1 out of 10 experience postnatal depression. So If you're suffering from this condition, you are not alone. And I used to tell people that speaking up or seeking for help is not a sign of weakness, it's a sign of strength, because it takes strength for someone to speak up or to ask for help. So just know that you're not alone, and if you are feeling this depression, just seek for help. This postnatal depression occurs first year after giving birth. So what are the signs, or what can you see to recognize that you are having depression or someone around you is having depression? When the person is always in low mood, or persistent feeling of sadness and lack of enjoyment, what you find attractive or what you find interesting before, after childbirth you lost interest, it's a sign of depression. You just want to be alone, and most of the times you just want to be left alone, and you're always tired, and you can't explain why you are always tired, but you just want to be left alone. And in severe cases, some women will start having these frightening thoughts, especially thought to harm their child. This postnatal depression has risk factors, and it's believed that pregnancy hormone also plays part, and then environment also plays part. Like, if the pregnant, like this postnatal depression starts from pregnancy, it starts to develop during pregnancy, then after childbirth it manifests itself, because like a woman who is into difficulty while pregnant, and after giving birth she's still into difficulty, like financial difficulty, there is financial strain, she can't provide for the child, and she can't eat enough, or she can't even take care of herself. This can predispose that woman to developing this postnatal depression. Or a woman who suffers domestic violence during pregnancy and even after childbirth, this kind of women will suffer postnatal depression. And one thing with this condition is that most women don't seek for help, because they don't want society to judge them, or they don't want society to feel they are weak. But I say it again, you are not weak, you are very strong for speaking out and seeking for support, because not everybody that has that willpower to speak out or look for support. Always seek for help, especially if you start having thought of harming your child, because some women during pregnancy, maybe for example you are size 16 before pregnancy, then during pregnancy you are size 18, after childbirth you see yourself going to size 20. Just that alone can trigger some women, just because their shape have changed, and they are like, because of this child, I'm from size 8 to size 20. They are no longer happy with themselves, they're no longer happy, nothing makes them happy around them anymore. Even their husband can no longer make them happy. And because we are trying to be strong, looking at our child, we tend to draw strength from seeing the child, or try to be happy for the child. But in actual sense, some women will have that thought to harm that baby. So always seek for help, and you definitely get help, because healthcare providers are trained to recognize this postnatal depression and also to offer solution to it. So what can you do to manage this condition? Self-care, like I said, seek for support, exercising, talking therapy can also help you. When your healthcare provider talks to you, try to be open and voice it all out. It will really help you. And then in severe cases, doctors can prescribe some medication to help the woman. In conclusion, like I said, you are not alone. Always seek for support, and then prioritize your well-being and that of your family. And if you see someone, or you know someone experiencing this postnatal depression, please don't hesitate to ask or to encourage the person to seek for professional advice. Thank you for watching this video, and I hope you've learned one or two. Share to others and invite your friends to follow this page. Bye. See you next time in my next video. Nobody talks about this after birth pain, a whole new episode of contraction. Even if you are told, you will not understand it until you experience it. But today, let me tell us what is after birth pain, so that tomorrow you won't say nobody told you there is something called after pain. So after pain is a sharp pain in the belly that occurs in the first few days after delivery, and this may cause some discomfort. To some women, they describe it as period pain, but to some it's not just like period pain. They describe it as a severe period pain or severe cramp pain, like they are going into labor again, severe contraction again. That is how some women describe it. So this afterbirth pain, we also call it involution. Like they are the involuntary cramping sensation that occurs as your uterus is trying to return to its normal size after birth. After pain is caused by the contraction of the uterus. After delivery and uterus is not contracting, it's another problem. So this uterus is supposed to keep contracting so that uterus will heal and then return back to its normal size. So the process of this involution involves release of oxytocin, release of hormone oxytocin, which will stimulate uterine contraction. After pain or after birth pain is noticeable during breastfeeding. If you are breastfeeding your baby, you will feel this pain more because during breastfeeding there is a release of oxytocin. Remember I said it is caused by the release of oxytocin, which makes the uterus to keep contracting in order to return to its non-pregnancy state. So during breastfeeding, this hormone is being released during breastfeeding and it causes this contraction more. So this is why during breastfeeding you feel the pain more. So, and as you are feeling that pain, it is being helpful. So don't be afraid to breastfeed your baby, or don't be afraid of this pain and you don't breastfeed your baby. Although breastfeeding can intensify after pain, so it also helps the uterus contract more effectively, thereby aiding in its return to normal size. So you can manage this pain or treat this pain depending on the severity. You can use pain relief. Your doctor can prescribe pain relief or you get it over the counter, but make sure you mention to them that you are breastfeeding. And you can also use a warm compress, apply warm compress or use a heating pad on the lower abdomen. It can help to provide relief. Then you can try changing position, like lying down, sitting down. Just try to change position that will help to alleviate the discomfort. You might be lying down, maybe if you change position and sit up, the pain might relieve a little bit. Or you might be sitting down, you can try to lie down and see if you can elevate the pain. Stay hydrated. Staying hydrated can help reduce cramping. It's very necessary you stay hydrated during this cramping. Then adequate rest is very important also. It will help you and avoid strenuous activities. But in everything, remember to consult your healthcare provider in case you are having severe or persistent after pain. They will provide you with treatment and care or advice. So thank you, and I hope you've learned this one today. And don't say nobody told you about after pain. Thank you, and keep following our page. See you next time. Bye. If you are preparing for a C-section birth, then today I'm here to give you some tips to help you get ready and also help you with recovery. A C-section birth is a major surgery and recovery can take about 6 weeks or longer, so no rushing. One thing to do is to ask friends or your family for help when you come home from the hospital, and they should also stay home and get your home ready while you are in the hospital. Then while you are home, they should also help you to take care of your home and also take care of you. And if you have older children, prepare them for what to expect. Tell them that when you return home, you are coming home with a baby and you won't be able to lift them. Explain to them why you can't lift them as usual. Make them to understand. It will really help you. And number 2 is about your baby's item. You need to bring all your baby's item closer to you, like your baby's diapers, clothes, and everything you'll be needing every day. Just bring them closer to you for easy access. Also bring your baby's nappy bin close to you where you can be able to discard used diapers. Then you need to have extra or plenty of pillow on the sofa for comfort while you are sitting down. You need those pillows for extra comfort, because after a C-section surgery, you experience some pain, swellings and discomfort around the especially around the incision site. Because of the pain and discomfort, you may feel very tired and have difficulty walking around, especially during the first few days after the surgery. So this is why you need help around the house. This is why you need to get things closer to you for easy access. All right. Then number 3 is to prioritize rest. Ask for help, as I said earlier, because rest is essential for healing. You need to allow yourself time to recover. Number 4 is to take care of your body. The incision site need to be cared for. You need to keep the area clean and dry, and always follow your healthcare provider's instruction for wound healing. It will really help you. Then avoid heavy lifting for the first couple of weeks. You don't have to lift anything heavier than your baby. All right. Then stay hydrated. Proper hydration supports healing and overall well-being. Number 5, you need to focus on your mental and emotional health. Bond with your baby and also spend quality time with your baby. Skin to skin contact is also helpful. You need to always seek for emotional support. Talk to someone, talk to friends, talk to family or a counselor if you are feeling overwhelmed, because after C-section, many women feel overwhelmed and anxious. Always be kind to yourself and give yourself time to recover. No rushing. After C-section birth, no rushing. Don't rush to recover in order to start tying your tummy to get back to pregnancy shape. No, don't rush it. Allow yourself time to heal. Then number 6 is to manage your pain with the pain medication your midwife or your doctor prescribed for you. Take your pain relief and also keep on to take your prescribed prenatal vitamin. It will help the wound healing. Number 7 is to understand your body's postpartum signs and symptoms. You need to be aware of unusual symptoms. Maybe you're having excessive bleeding, you're having a fever, you're having excessive pain, or you are passing a large clot of blood. Please always seek for your healthcare provider's advice. Please, it's very important. Number 8 is to eat for nutrition and energy. After postpartum, you need food. Focus on balanced diet with plenty of fruits and vegetables, with whole grains and protein. Please, it's not after delivery through C-section you keep on drinking pap. It's not nutritious. You need nutritious food to help the wound healing, because you don't want to hear a story about wound breakdown. So you need food. You need to eat nutritious food. Aim for proteinous food. Eat vegetables. Don't just keep on taking pap because you had C-section. It won't promote wound healing. And your baby also needs that nutritious food from you in order to make more breast milk for your child and also give you energy. Taking only pap will not give you the required energy, and it's not helping your wound to heal. So why not eat nutritious food after C-section birth? Delivered through C-section doesn't mean your delivery is abnormal. Then you don't have to eat nutritious food. You keep on drinking pap. It's not okay. So always aim to eat nutritious food after delivery, irrespective of the method even. Because even if you deliver through VG and you had tear, you also need nutritious food to aid or to promote wound healing. Please, very important. All right. 9, get regular postpartum checkup. Attend your follow-up appointment with your healthcare provider, please. This visit is very important because it will allow monitoring of your healing process and address any concern you may have. So please don't skip your postnatal checkup. Number 10, if you are experiencing pain, redness, swelling, or any other unusual symptoms, like I said, always reach out to your healthcare team. They are always there to support you during your recovery. They're always there and they're happy to offer this help. So always reach out to them. Anytime you don't understand what is happening or you are concerned, reach out to your healthcare provider. The last but not the least, number 11, remember everybody's recovery is unique. We are all different. We are unique. So always listen to your body and seek for help when you need one. So wishing you safe delivery, whether you are going for C-section or VG delivery. Wishing you all safe delivery, healthy and speedy recovery. Thank you for following this page and keep inviting your friends to follow us. Going to visit someone who just had a baby, then you need to watch this video to see the list of things you need to do. Number one, you need to call ahead of time and make sure it is convenient for them before you visit them. In fact, whether you're going to visit someone who just had a baby or not, it's important you call anyone before you visit them. Don't just visit anyone unannounced. Don't turn up at anybody's door unannounced. Okay, so number two, don't visit if you're unwell, whether you have cough, cold, catarrh. Don't just visit if you're unwell, because you're going to visit a newborn who immune system is not properly developed. The baby has a lot of things to do with his or her immune system, so don't go and add to it. Part three, make sure before you enter the house, remove your shoes and don't give unsolicited advice to the new mom except she asks you for your advice or suggestions. Number four, no smoking before arriving or smoking near the house, please. Number five, wash your hands before you carry the newborn, and if they offered you water to wash your hands, please don't feel offended, otherwise don't visit. Number six, don't expect hospitality, but ask them what you need to do for them. Do offer to help them and do some things. Don't expect them to serve you, but ask them what you can do for them. Ask them if they need anything. You can help around the house, do some house chores for them. Number seven, if you have children you are going with, please go along with their snacks and make sure your children doesn't run around the house. Be sure to clean up any mess after them before leaving the house. Number eight, don't kiss the baby on the face or lips. In fact, don't kiss the baby at all. Even you, the mother of the newborn, don't kiss your baby on the lips or on the face. Please, very important, avoid kissing newborn, especially when it is not even your child. You went to visit someone's child and you are kissing the person. It doesn't even make sense, and we are trying to prevent some infections to the newborn. So please, once you visit, don't kiss. And once you try to kiss and the mother said don't kiss her child, please don't be offended. You don't even have to do that in the first place. And then if the mother tells you not to, please don't start keeping malice or grudges. Don't kiss, please. Number nine, don't overstay your welcome, please. 20 minutes is okay. In fact, 20 minutes is a lot of time. Don't overstay your welcome. Greet the newborn briefly and you leave the house. Give them space. The mother needs this time to bond with the child. So don't overstay your welcome. The mother may even need to go in and rest, but because you are there, she has to be there with you. So please don't overstay your welcome. Okay, so that is it. What did I miss? Did I miss anything? So you add some in the comment section and make sure you are sharing our videos to others and you're inviting your friends to follow us. Thank you for staying here with us. Bye. See you next time in my next video. Which one then is good? So I need to respond to this question via video because I know a lot of people might have this same question. I made a video on different positions of placenta and I figured out that it means most people did not really get it. So I'm going to make a clearer video in response to this question. When it comes to placenta position, the best position for a vaginal bed is when the placenta is located away from the cervix and does not cover it. Once your placenta is not near or covering the cervix, the position of that placenta possibly could lead to vaginal birth. Because I know that is what the question is all about. Which one then is good? Because I know she's trying to talk about which one will now lead to giving birth via vagina. And to some people, they believe that giving birth through vagina is normal. No, there's no normal or abnormal way of delivery. But if you are trying to know which placenta position can lead you to having a delivery, then let's have it. So if your placenta is not covering the cervix or near the cervix, it allows for a smooth progression of labor and possibly delivery. Let's look at anterior placenta position. Like I said in my video, the location of this anterior placenta is positioned at the front of the uterus, and most time it is considered normal position. The benefits of this anterior position is that it allows for optimal fetal positioning. It facilitates a smoother birth process. So vaginal delivery is possible if your placenta is in anterior position. Now the next one is posterior placenta position. In this case, the placenta has implanted itself on the back of the uterus. What this means is that you may feel your baby's movement earlier and stronger. Posterior placenta allows your baby to get into an optimal position for birth. This is also common and often lead to vaginal birth. So if any other positions of your placenta and the doctor have advised for C-section, please go for it. It's still normal way of delivery. If there is any problem with your placenta and the doctor or the midwife advise C-section birth, please go for it. And if your placenta position is okay for birth, it's okay, you go for it. So I just mentioned the positions of placenta so that most women would know the different positions of the placenta and which one could possibly lead to birth and which one could possibly lead to C-section birth. And I mentioned in my video that low-lying placenta, if it does not shift upwards, it means that it might end up with C-section birth. And then I mentioned placenta previa, where the placenta covers the cervix completely. In this case also, you are going for C-section birth. Please don't say otherwise or do otherwise. It's for your own good. Thank you for watching this video. Remain positive, remain healthy, and don't forget to always seek for your healthcare provider's advice in whatever you are doing during pregnancy. Bye. Placenta is an amazing organ that is being developed during pregnancy. This placenta gives your baby everything it needs in the uterus and also help to take away whatever the baby does not need, like carbon dioxide. During pregnancy, the placenta is attached to the wall of the uterus and is attached to the baby through the umbilical cord. The placenta is usually found at the top, but it can be found in different positions. So this is what we are going to discuss today. Different positions where the placenta can be found. You know, when you go for ultrasound, the sonographer will check the position of placenta. This is because some position can cause potential complication. Some of the positions of placenta, number one is funda. This is where the placenta is at the top, is attached at the top of uterus, and this is the most common position. Number two is anterior. This is where the placenta is at the front of the womb. This does not cause any problem, but it may mean you do not feel your baby move until later on in the pregnancy. Number three is posterior placenta position. Here, the placenta is attached to the back of the uterus. Number four is lateral position. This is the least common position. The placenta is implanted on the left or right side of the uterus. Number five is low-lying position. If your placenta is in a low-lying position, it may make it difficult to deliver your baby. You'll be given an extra ultrasound scan at 32 weeks to check on the placenta, to check on the position of the placenta. In 90% of the cases, the placenta will move forward up the uterus. But if it remains low, it can cause bleeding in the third trimester, and you may likely be requiring a C-section birth. Then number six is placenta previa. In around 1 in 200 pregnancies, the placenta will completely cover the cervix. If this is the case, you'll be given extra care and monitoring, and your baby will need to be delivered by C-section birth. Hope this helps. Keep inviting your friends to this page. Bye. Hello, mothers. Quick one on low-lying placenta, because I've seen some questions on low-lying placenta, even though we've made a video explaining low-lying placenta. If you have gone for scan, early pregnancy scan, and the result comes out that you're having low-lying placenta, please, there is no need for you to worry, especially if you are still within the first trimester, because within the first trimester, like 12 weeks, 14 weeks of pregnancy, the uterus is still small and it's accommodating the placenta and the growing fetus. So to some people, the placenta will attach at the lower segments of the uterus, but you don't need to worry, because as the baby is growing, the uterus is growing, it's expanding, it's also pulling the placenta along and taking it upwards. So in some women that present with low-lying placenta at the beginning of the pregnancy, they will find out that as pregnancy grows, the placenta shift upwards. So if you can go for another scan, let's say in second trimester or third trimester, you will find out that the placenta has already move upward and no longer low lying. So that's why I will say you don't need to worry if you go for scan first trimester and the placenta is low lying. Please don't worry. Stop seeking for remedy on how to push the placenta upwards. No remedy. There's no how you can manually push the placenta upwards. The only thing is for you to relax, because the placenta, as pregnancy is growing, the placenta will shift upward. But in some women, you find out that at the third trimester, your placenta have not shifted up, it's still low lying. So these are the women who always advise to avoid doing anything strenuous, like strenuous exercise or engaging in strenuous intimacy with the partner, because it can bring about bleeding. So aside from that, you need to calm yourself down and don't believe in any remedy or a remedy for low lying placenta. There's no remedy, please. And make sure you take care of yourself very well during pregnancy. And remember to keep following our page so we can bring you more on pregnancy tips and women's health. Invite your friends to follow us also. And remember to follow our Facebook group, Midwives for All by Mary Informa. Please follow this group so that you can always bring your question. We will approve your post so that some midwives there will give you advice or answer your question, and then experienced moms in the group will also attend to your questions or your word, because sometimes we might not always be attending messages in our DM. Though our DM is open, we attend to messages, but if you can join the group so that you can post your question as anonymous, we can approve it while you stay and read the comments. You understand? It will help you and help other women that might be having similar concern with you. Thank you, and stay positive and all the best. Bye bye.